Absolutely. So for those of you who I've never met before, by introduction, my name is Irene Liu, and I am the News Lab lead for the Google News Initiative. Since all of you who are on the call are members of the India and Indonesia training networks, it is a wonderful pleasure to have all of you here together in this wonderful community. And with that, I'd love to introduce our speakers. And for our speakers, if you could just give a little wave when I say your name, that'd be great. First, speaking, we will have Dr. Ankor, who is with Médecins Sans Frontières, and he will give us an overview of what is happening with the disease. And then we actually have Owen Sweeney, who is familiar to all of you, our wonderful OSNIT expert, who will give a kind of global view of what's happening in trends in our infodemic that is covering our, epidemic, or as however you want to put it. And after that, we actually have Ika from Indonesia, from Tempo, who is a fact checker and will talk about misinformation that she is seeing on her platforms as well. And then last but certainly not least, we have Qian Sun, who is a health reporter from mainland China, who's actually working right now with data leads on doing coverage, health coverage of the coronavirus, and also helping to fact check and debunk the misinformation that we're seeing. She'll talk about the trends of what's happening in China and on a very important platform, WeChat, as well. So with that, I will hand it over to Dr. Ankor to get started. Dr. Ankor, please take it away.
Okay. Thank you so much, Irene. Like you said, we'll begin up with talking about the major issue around this epidemic in addition to the epidemic itself. So as Irene mentioned, I'm a medical doctor and epidemiologist, and this is something which we are also, every epidemiologist, every medical doctor is also following it up very strongly. So the topic today stays around, it's an epidemic of misinformation and disinformation, and the presentation is around, let me just write. Yeah. So we'll quickly go into the introduction of the main objective of this webinar, then the origin of the outbreak, spread of the outbreak, and the scale of the outbreak. So if you would know that on 15th February, during the Munich Security Conference, the Director General of WHO, Dr. Tedros Adhanom, made a very, very pertinent comment that we are not just fighting an epidemic currently, we are fighting an infodemic, and which can be in some ways much worse than the epidemic itself. You would have noted, and the audience right now with us is very importantly aware that there are lots of inaccuracies and conspiracies which are being repeated and perpetuated by the social media, and it's really difficult even for the medical community to pinpoint at what's right, what's wrong, and I've had friends within the medical circle who are also facing this issue because there's just tons and tons of wrong information traveling around, which makes it very, very difficult for even medical professionals and people to take the right kind of actions to definitely for the general population to do the right thing and to make right choices. And not be swayed away by disinformation. So the need of the hour is to spread the right information, have really good systems in place for data sharing, unhampered communication, and the need of the hour within the medical communities, peer-reviewed research, which will bring about the best information. And it's not conventional research where you take years and years of randomized control trial, but it has to be of quality, peer-reviewed. So we'll talk a little bit more about that. But just beginning this conversation on this infodemic with an introduction to the epidemic. So we know it's a coronavirus, and it has been named as COVID-19. So it's a large group of viruses, and in fact, the name coronaviruses comes from the Latin word corona, which means a crown. So the virus itself, if you see, it has protein spikes. I'll bring this picture to the center. So it has protein spikes around it. It has a nuclear material inside of the circle, which gives it a kind of an appearance of a crown, and that's why the name coronavirus. It's similar to the Middle East respiratory syndrome and also the SARS coronavirus. And there are lots of different coronaviruses around there. They have each different kind of different clinical presentations, different pathophysiology, but it's different from them. And that is basically what a coronavirus is. It's different from the others one, but it's related to them. It's derived most of the time related to bats. So this is just the brief timeline of the event itself. So it's a large family of viruses, and as I said, that it's found in animals. It's found in and sometimes they find a way to jump into humans, and that's where when the pandemic and the epidemics begin. And so it is a beta coronavirus like MERS-CoV and SARS-CoV. All three viruses have their origin in bats. On December 31st, the WHO, the World Health Organization, was informed of an outbreak of an unknown pneumonia. So basically, the pneumonia did not have an origin very defined from the Wuhan city, the 7th largest city in China. And the cases were linked to the wet market. So there's a wet market where animals and meat is being sold, and many of the people were stall holders in that market. On 13 January, Thailand reported the first international case outside of China. And if you see the last point, that on January 22nd, our WHO emergency committee was convened to discuss whether it should be put up as a public health emergency of international concern, which is a terminology used as per the international health regulations when an outbreak is not being able to be controlled nationally, and an international consolidated response is required to handle a situation like that. So at that point, they did not decide to make that declaration, but eventually it was put up as a public health emergency. So just quickly going through the major ways of spread, the right information regarding the spread of the epidemic and how the disease spreads. It's from person to person. The viruses start mainly to go from person to person. So if the person is within 6 feet, and that's the range where the close contact happens, and the disease can spread via respiratory droplets. So if somebody sneezes, if somebody coughs, and the droplets can land on the places nearby, and then if you touch them and they're not destroyed by that time, you can get that. But again, like any other viruses, they are not supposed to stay there forever. They get destroyed very soon after a while they have been exposed to the environment. So like the second point mentioned, and which is very important to know, that and these all information are taken from links which are put down for you so that you can go through them in detail. And every time you have a question, you can come back to those links to get the updated information, because a lot of this information gets updated as we go, because it's a new disease and more research. And that's what I want to emphasize upon, that it's a lots of peer reviewed. When I say peer reviewed, it means from the scientific community coming together to review the evidence around it, and the scientific literature and the scientific experimentation which is being done to see what are the right information. So believe that, and that's why the links are down there. You can go to them, and there's similar links. So these are the links which I usually refer to. You'll have this presentation, but just going quickly that it's by touching a surface or face or an object that the virus has been on. But this is not thought to be the main way the virus spreads. Like any other flu, this is not the main way. The main way stays around direct close contact. When does spread happen? So mostly people are symptomatic when they are contagious. There have been reports that when people are not completely showing their symptoms, they are still contagious, but the symptoms could be subclinical when the patient is not coughing, but it's still going through that process of that phase of being sick. And again, the most efficient way is person-to-person transmission. And yeah. So most of the cases are because of close contact, the healthcare workers who are working for them without personal protective wear, or the people who are taking care of the patients, or somebody who has been exposed because somebody coughed on them, or they were taking care of a person. For the scale of the outbreak, you hear a lot of news every day. So this is a very important link. And so I'll try to open the link for you, and I hope it opens. Just give me a second. So this is a website which is put together by Johns Hopkins University, and it gives real-time information about the outbreak. And in my experience, this has given me the best information in real time collated from different sources and GIS data. GIS stands for Global Information System. geographical information system, excuse me for that. And then you get this database. So I hope you can see my screen. And so for example, if I want to look into the total number of cases, I have 82,170 cases. Then you have the total number of deaths here, the number of people coming from mainland China, Iran, 20 deaths in Henan, mainland China, 13 deaths in the respective areas. So this gives you an idea of what and where the main cases are. And this is something which is very reliable, and the data sources are very reliable. So you get the information from there. For example, I know that most of the people are joining from India and Thailand. So India and Indonesia, so forgive me. So for example, if I want to look into India, I can just click on India, it will take me there, and then the total deaths have been 0, and then the number of cases recovered are 3. Then, of course, these are based upon validated information, and I'll just talk about that in the subsequent slide. So let me go back to the So this is the next slide is just the same thing, but it talks about which India and with a focus on Indonesia. There are lots of literature which is moving in, and one of the ways in literature to have the most robust information is look at the existing amount of work done from different scientists, collate them together and judge them on the basis of the validity of their evidence and the methodology which they used. For example, you can treat a patient with lots of things, and because the natural cause of a disease is eventual healing, or it's eventual, unfortunately, not healing and passing away. So sometimes you have to have, in research, you need to put specific mechanisms in place which helps you give the right information without these biases that it's the patient's immunity which helped them heal, or did their intervention help them heal. So based upon that, a lot of literature is available on some websites, and I put together the systematic review. So the information which is based upon lots of validated literature, and put together how the management of the patient should be. So if they're mild, they should be managed this way. If they are severe, they should be managed this way. If they show acute respiratory distress, this methodology, sepsis and shock. This is a link down there where you should go, if you get time to go to it, and you will see a lots of information which is consolidated together in the way methodology for treating them would be. So again, coming back to the main topic of this, of the objective of this webinar, that you know, the infodemic can be sometimes much worse than the epidemic itself. So how to access the right information? In the first link tells you how to access the numbers in real time globally. And the second is about WHO website, where they are talking about the novel research which is being done on this virus and the information related to it. CDC helps you answer lots of the frequently asked questions, which is very important. And then definitely for those from India, the Ministry of Health and Family Welfare have put down really good guidelines on their website, which the link, and you can actually see the travel advisory, discharge policy, guidelines on clinical management, surveillance, infection prevention, sample collection, packaging, all in a PDF format on this website. So that just highlighting the fact that how important the infodemic becomes when an epidemic happens. So giving the floor back to Irene and Egon, Sweeney, and yeah, thank
Great.
you.
Thank you so much, Dr. Ankur. We do actually have a couple of questions. So I think just because it's a few and they're quite quick, I thought we would just ask them now so that you can answer them in the moment. The first question we have is actually is a very simple one, which is, can you please make these links available? And I think that your answer was that you would make these slides available. Is that correct?
Yes, the slides will be available to you, so you can, and the links are at the bottom, so you can just click on them and it will take you straight away to the website.
Perfect. Thank you. Since all of you registered, we will be sending that via email after. So you'll be able to have access to these slides after that. And then the second thing, Wardoyo, who asked, when someone has a good immunity, is it still possible to become a medium of spreading the coronavirus, even if you don't show any symptoms?
Okay, so that's a very good question, actually, Danang, right? So it's a very good question to ask. So like any other flu, your immunity plays a big role in you healing through the process, and the part of the healing is that you become immune to the causative pathogen, and that's mostly true for most of the viruses, except for retroviruses, where they actually integrate into your system and stay there. In case of coronavirus, it's not that. So from the more evidence is coming up, but it's very clear that it follows the same mechanism as as a normal influenza virus. The course of the clinical progression is much severe, and that's why the higher mortality related to it, because nobody is exposed and immune to this. So let me try to explain it much better like this. So if a new flu virus comes to you, everybody becomes sick. And then after they are sick, they develop an immunity to it. So people who are like the word you use, medium sick, they are medium sick because their immunity is strong enough to handle the virus. For them, becoming carriers is not possible in my scientific understanding. More evidence will come, and but as per the literature and the biological plausibility of becoming a carrier of a virus where you handle it by becoming immune to it, it's not there. So I don't know if I answered your question well, and
I think that the main point of the question was, if you don't have symptoms, is it possible for you to basically spread it to someone else?
So in the beginning, that's a very good question, and the scientific community is also worried about that, because all our screening processes at the ports and at the checkpoints are based upon that. There have been reports of people not being symptomatic at that point, which is true. So your question is very validated. And if you go back to the presentation, I do mention that in one of the points that the patient is not symptomatic, and there have been reports about that. More evidence is going to be available for that. But I think the second part of the question is also about, can they become corona spreaders if they, no, you didn't actually put in as career, so that was my mistake. So for them, becoming a career is not possible. Sweeney or Elaine, would you like to
yeah, just something, Dr. Ankur, something I read, I can't remember whether it was on the WHO or CDC or wherever it was, but there was some suggestion that at least if somebody is asymptomatic, that then by virtue even just of the mechanics, because they're not coughing, they don't have running nose and so on, that they would at least be less virulent of a spreader of it. Does that accord with what your expertise would say?
Yes, that is what I'm trying to say, that in fact, you put it up much better in the way that, for example, like you remember the spread from person to person, it's based upon a close contact, and when you cough, you have your droplets and the infections around it. So that's not happening, and so that's the major reason. But for example, if the person is not symptomatic enough, but it's still enough symptomatic that he's not coughing, that could be a case, but then it needs to be a very close contact to be able to spread that. So
great, thanks.
Great, thank you. I'm just going to quickly check to see if we don't have any other questions for the moment. So thank you so much, Dr. Ankur. Why don't we now move on to Owen? Could you give an overview of the situation of the infodemic that we are facing?
Yes, thank you, Erin. So yeah, I was definitely very interested in the expression infodemic, because one of the things I found that, the World Health Organization and others have been saying, let's be vigilant, but let's not panic. But in terms of the actual mis and disinformation being spread, I think it's far closer to the definition of a global pandemic, because there are many places around the world that have not directly experienced COVID-19, but where people are behaving in ways that are influenced by the information that they're receiving. And that information is not always accurate, to put it mildly. So I think we can definitely speak of an epidemic or a pandemic of mis and disinformation, with all of the attendant problems that brings. So what are the roots of this? First of all, who is spreading this disinformation, why and how? And as I start out talking about this, it'll be more of a general survey of this is spreading the same way that disinformation about many other things are spreading. What are the sources? People are getting this information from friends, relatives, contacts on social media. And this, of course, does present difficulties because you are inclined to trust and take things as more valid if they're coming from your peer group. So there is a responsibility on all of us to be very, very prudent in what kind of information we spread. Then, of course, more relevant to the group that we have together today is the media, and that's right across print media, broadcast media, online media. And I'll go in more in a couple of seconds into how dangerous that can be. Now, the means of transmission, again, just keeping with the metaphor of an epidemic, that you have text-based claims, you have people receiving messages, seeing social media posts, making all kinds of claims. You have photos and videos, things claiming to be of Chinese soldiers rounding up people to be buried alive, and this sort of crazy stuff that we're getting. And memes, of course, and we know from research that's been done over the last couple of years that memes can be very powerful. They elicit a visceral reaction. People remember them for a long time, and people are influenced by the information that they get through them. And why? What creates the conditions for the spread of this epidemic of mis and disinformation? And part of it is that people have genuine fears. There's a survival instinct. And this is something that goes back to our earliest history as human beings, I presume, that sharing of information is a protective measure. It's a warning instinct within our herd, within our group. And people, if they see something and they think that may be pertinent to the survival of their friends and loved ones, there is a strong instinct to share that. Then, of course, there are monetary motivations also. People selling cures, snake oil, people monetizing social engagement. And this is something that we in the media have to be very, very careful of. That we know that sensational headlines will bring more hits, but is that really what we want to be doing in a situation like this? And of course, then there are ideological motives also. Demonization of certain groups, blaming people for this, and using it to corral support against groups that you have an animus toward. Now, disease and disinfo, there are a lot of similarities. I don't want to labor the metaphor too much, but there are important things going on here. The similarities that they're passed from person to person. Now, that may be in the virtual sense in the case of information, but also, the spread can be exponential. One person infects somebody else, they infect 3 more, each of them infects 3 more. The exact same with information. Now, there's a key difference when it comes to our role in the media, that we have the facility for mass communication. We can become, to again put it, parallel it with disease, we can become a super spreader. We can almost have a bioweapon effect because we can take that one piece of harmful dis or misinformation and we can communicate it to huge numbers of people at the same time. And that, of course, hugely accelerates the spread. So we have to look and think, what are our purposes in reporting this stuff and what are the effects? Of course, there is a positive side to it. We need to increase awareness. We need to increase, at least to some degree, the sense of urgency among the public in order to encourage healthy habits and in order to make people aware of what they need to be doing. But of course, you do not want to create an unjustified atmosphere of fear and panic. We are seeing so many side effects of the spread of information. We're seeing, for example, here in Europe, we've seen quite a few anecdotal reports of East Asian people or people of East Asian appearance being discriminated against, being abused. You also have situations, I believe I saw one story from India, where a man who thought that he had coronavirus committed suicide for fear of passing it on to his family. And I believe the autopsy showed that he had a normal flu. So these are the kind of things that we absolutely want to avoid happening. So the keys to our reporting in this, we have to be accurate and we have to be clear and unambiguous in the way that we report these things. Accuracy is so important, and we really need to keep away from the fear of missing out, that because other places are reporting something and it's getting a lot of hits and engagement, that we need to be doing that too. This is a problem that goes much deeper into the state of modern media, where we go after metrics. We're worried that our competitors are getting all the hits and all the attention. But if you find yourself putting a line in a story that starts with, "It's being reported that," I hope that you get an instinctive urge to stop and see, where is it being reported? What's the basis on which it's being reported? Is there source information that backs that up? Because I've seen so much copy and paste reporting going on recently, right across the world. And you see things like, "according to scientists," or "a study says," and no link, no identification of who these scientists are or where this study comes from. And, to me, it's obviously, when I see that a lot of the time, it's, well, to put it politely, it's something that came from the rear end of a bull. So you really want to take responsibility for anything that is going out under your byline or under the masthead of your media outlet. So when we're debunking false information, one of the things I think we need to take a very methodical approach to this. Clearly identify and target each claim that's being made. In a single sentence of information that I've seen, you can often pick out 3 things straight away that you can target. One of them will be very obvious. You have the thing that you see so often: "Why is the media not reporting about this?" I mean, that just usually takes a quick search on a search engine and you'll see it appearing all over the media. That should give you cause to be suspicious. When people are trying to gin up interest in something by reporting it as a secret or a cover-up, that's always a dangerous thing, and that's one of the easiest things to check. Then look at figures. Look at every fact that is being claimed. Think, is there a way I can check this quickly? And when you're producing rebuttals, where at all possible, please look for primary sources or look for official sources. Things like the World Health Organization, the Center for Disease Control, and so on. Credible outlets such as The Lancet, which I saw Dr. Ankara, I think, produced a link to there. So you have to see where this information is coming from and give people reliable information from reliable sources. Where possible, show the figures, show the statistics. Don't rely on the anecdotal claim. And be prepared that there will be pushback. You will be accused of assisting in the cover-up. You will be accused of having an agenda to push. But it can be very ridiculous at times. Have a strategy, be ready for calm and clear rebuttal of that. So again, you have to be clear in your debunks. Be clear about what your motives are. People say things like, "Well, better safe than sorry, so let's believe all these crazy rumors." Point out to your readership, your audience, that false information can very, very often make things worse rather than better. It can create panic, it can create animosity between groups, and it can lead people to go looking for cures that may be at the expense of getting proper treatment. Explain possible motives. If you're seeing some source spreading a lot of disinformation, look into this and see what is the motive behind that. But please avoid speculating. We don't want people saying that a particular group is doing it, or we don't want to gin up hatred against anybody. But try to see why things are being spread. And if it's very clear and very obvious, don't be afraid to report that also. Now, one of the things we know is that you need alternatives. If you don't provide good information to push out the bad information, you're liable to get swamped. So where possible, try to provide accurate alternatives and options to the lie or to the mistake. Fill this gap, because people will very often be confused because they don't have good information, so they will cling to whatever they can get. There's also a despair reaction, people throwing their hands up and saying, "Well, I don't know what to do." Let's try to give people reassurance and empower people to actually make better decisions. Then what are the measures? Again, I don't want to overstress the metaphor here, but like disease, we need to be taking measures across a spectrum, for short, medium, and long term. once the disease or the information is out of the box, yes, we do have to tackle the symptoms. We do have to take on this disinformation and misinformation case by case. If it is gaining currency, if it is gaining traction, we do need to address it. So let's debunk, let's inform. Then shaping the environment. This is, I would parallel it with hygiene and sanitation, the role that plays in shaping the environment to discourage the spread of disease. Well, in terms of information, we need to continue our efforts toward spreading information literacy, toward spreading basic educational and critical thinking and critical approaches. So while we do need to tackle the acute symptoms, we do also need to look at the situation on the ground. How can we make a less fertile environment for this kind of thing to spread? And then absolutely crucial, I think, and it's great to see all the different people on this, because I've said, our cooperation needs to be cross-border, it needs to be cross-culture, and it needs to be multilingual. Because if you're seeing a video, for example, that claims to be out of China, maybe you don't have Mandarin, maybe you don't have the expertise to go looking for where that may originally have been taken from or copied from. Great if we can have a group of people who are conversant in all the relevant languages and cultures. There's an awful lot we can do to help each other out here. And of course, I didn't say here, but multidisciplinary as well. People like Dr. Ankur here, we have journalists like Ika who are used to chasing disinformation and so on. And we're part of a very large group here with a lot of different disciplines, a lot of different forms of expertise. And I really think there's a huge synergy we can take from that. I've just put my contact details up there. If you have any questions about anything I've said, please let me, I'll be there for people to ask me questions, basically. So please don't be shy to reach out. Now, I'm seeing a question here on the messaging. It's from Aji. To own, since the many unknown nature of the virus leads to many unproven claims, which sometimes cannot be debunked easily and timely, what's the best effort, in your opinion, to counter this? That's the age-old question, isn't it, with disinformation and misinformation, the absolute flood of it. I think we have to be, what would I say, focused in our efforts, try to prioritize, try to, again, to use a medical metaphor, try to triage and decide what is most urgent, what needs to be dealt with right now, what's getting the most traction, but also balance that. I mean, a lot of you guys are journalists, you're used to making, for example, editorial decisions. So it's not just what's getting the most traction and what's getting the biggest airing, but you have to balance that against what is the harm it could do. If you're seeing something that's getting shared among millions and millions of people, but it's rather trivial, I would rather look at the thing that's being shared among tens of thousands, but is potentially very dangerous. So if you can prioritize what you're tackling, that would be good. Then also to try to get into this information space with good, accurate, and helpful information, because you need to give people alternatives. You need to create a situation that when people see something like, I remember a couple of years ago, I was in Delhi at the beginning of November, which of course is peak pollution time. And I remember there was something going around that it was fine to go out and breathe that air as long as you were eating jaggery on a regular basis. And this kind of thing, obviously, it sounds amusing at this remove, but it's dangerous. You do not want people to be getting information that will allow them to take risks that they otherwise would not be taking. So let's tell people, let's be proactive and tell people, here are the positive steps you can take. Don't worry about the crazy stuff you're hearing and the very obscure information. Here is what you can really do. Talk about hand washing, talk about sanitation, talk about eating healthy, exercising, all these things, because as I say, the best thing we can do long term is to make a more difficult environment for illness to spread. So that's all I'll say for now, because I really want to get on here about the more specific cases that people like Ika are dealing with, and Chen also. So thank you very much.
Thanks so much, Owen. I actually just want to acknowledge Simon, you raised your hand. If you have a question, I'm going to allow you to speak. So if you'd like to ask your question. Simon, did you have a question?
Yeah,
Go ahead.
can you hear me?
Yes, we can.
Yeah, I just wanted to know what about countries where coronavirus has not reached yet? Are there any campaigns being done so that there are precautionary measures which are being taken? Now, unfortunate part is we are sort of isolating and going on about nations which are affected by this virus. So, which is just unfortunate. And now globally, it's affecting businesses, globally affecting airlines. So, what can be done about people who are sort of immune to this and who can take certain precautions against this misinformation?
Yeah, I mean, I'll leave the medical expertise to Dr. Ankur, but as far as I'm concerned, I mean, the question you're saying, are we seeing efforts to forestall this in countries where it isn't really a big issue? Well, I haven't done a really big survey of the global media, but I can speak anecdotally, for example, of Germany, where I am, where the health minister did speak a couple of days ago and released a public statement, made some very good points that, yes, he said COVID-19 is here in Germany. We have to accept that. However, the more serious cases we have been among old people who are a particular risk group anyway for all kinds of respiratory illnesses. And also that, yes, we have had people who have been diagnosed with it and have been treated and are now fine. So I think the German approach, as it is very often this kind of thing, is to go piece by piece and address things in a calm and sensible manner. And I think this is something I would like to see more of around the world. But of course, this is one of the things as media that we're often guilty of, is that we like to make things sound more exciting than maybe they merit.
Thank you.
Dr. Ankur, do you have anything that you would like to add as well?
I think Mr. Sweeney summed it all for Simon, but just wanted to add that for the countries where it's not the usual precautions which you would take for any flu is the ones which you have to take for this. Wash your hands, cover your mouth with when you sneeze, or use your elbow when you see, and that is the kind of information which in any case should be shared and promoted for a general health promotion within the community. So you would do the same kind of precautions which would be required for spread any kind of flu which is spreading. And like Suni again mentioned, the risk group stays the same. The ones who are already sick or they are of a higher age group, they are prone to every disease becomes more severe for a vulnerable age group. So nothing changes basically in that way. Just making sure that you follow the health promotion. The health promotion messages are the ones which should be spreading right now rather than the other ones.
We also have a question from the YouTube Live, which is that there have been claims. Ika, go ahead.
Yeah. And what do you think? Why the conspiracy theories always appear in every crisis in the world?
Why does this kind of information spread so much around the world? Yeah, I think we could spend an entire weekend talking about the psychology of why this happens. But yeah, I think a lot of it is the fear and the survival instinct, that people think, oh, could this be true? Well, if it could even possibly be true, isn't it better to let everybody know about it than to neglect telling people about it and let everybody get sick? And I think that's a huge part of it. It's also that in general, as human beings, we also like a bit of excitement. So I think, there are so many motivations behind this. There's also the little bit of vanity that you like to be the first one that got this information across to your friends. You look like the expert. But I think this is not specific to COVID-19. This is something that is very general right across mis and disinformation all the time, and with conspiracy theories and everything else. And it's something I think we have to tackle on an ongoing basis. We have to look into the psychology behind this and come up with ways to reduce it and to mitigate it.
Great. Thank you. We have a question from YouTube Live, and then I would like to go to Ika for you to present. But just this question, I think, is probably for Dr. Ankur. There have been claims and counterclaims on medication that are being used to treat the epidemic, information from UK and other parts of the world. And the question is, how genuine is this information and how should journalists cover it?
Okay, so again, a very good very good question, and a difficult one to answer as well. So there is in one of the links which I've shared with you, there are all the literature which WHO is compiling together, and that literature gives you. So if as a journalist, if I want to answer this question for you to be useful, it's best when you see a question, because there are lots of drugs which are being talked about, there are lots of strategies which are being talked about, but like you said, there like I presented, there is a robust methodology for treating, which is compiled together for any medical physician to approach it. In terms of the experimental therapies which are going on, which is your question, these get published and reviewed by peer scientists, and because the situation is an emergency, everything is coming into media straight away without passing through the channel of a proper scientific review, which, let me say, as a normal person, as a general population, part of the general population, I would expect this to happen, because this is something which might be useful, and you might think it is useful as well, like anybody else. So go into that website, check on the publications which are coming through that. They're very clear search words, and for example, if it's an antiviral which is being propagated as a treatment, go see whether 5 patients were treated with that drug and 3 of them recovered, and in a normal population, if you don't treat a flu, the same thing would probably happen. So you need a very rigorous way to tell, and a very biological plausibility around it, how it could go. So your question is very difficult. It's not easy to rule out a drug and to rule in a drug without having a proper evaluation scientifically about it. But follow the scientific body of evidence which is available with WHO, with CDC. Look into, so a claim comes to you as a journalist that this is a drug which is useful. Try to corroborate that information with the links and with the information you can get nationally, internationally on websites through reputed journals and reputed websites. Then see, evaluate, and then you make a decision that this is the information which should come out. And remember, you are very responsible. It's like Sweeney puts out, that it's very dangerous to put out an information like eating jaggery and being out, and when you shouldn't be out too. It is a difficult question to answer, but anybody wants to add to that?
I think you're the authoritative source on this one.
Okay.
Thank you. So
I would just summarize. In fact, I can just summarize again. In that case, is I just go back to the reputed options which you have. See your questions in the light. Don't if there's a one patient treated with a certain natural remedy and recovered, that's not the right way to report it, because you need to have you should understand, if you don't treat any disease, many of the times, most of the time, the body's immunity would heal them in any case. So this is true for any other disease as well. So
great, thank you. I think, why don't we move now to Ika to give a presentation about the situation in Indonesia. And I'm gonna take 1 second to now load the slides up.
Okay. Yep. Sorry, Irene.
All right, great. Please proceed.
Okay. Hey everyone, I'm Ika Ningtyas, a fact-checking journalist from Tempo Indonesia. I think it's a very important session to share about Tempo fighting back coronavirus misinformation. Okay, next. Yep, this is about me, but we go next. Okay, since last January ago, fact-checking organizations from 3 countries, including Tempo, have been collaborating through the International Fact-Checking Network at the Poynter Institute to debunk together the false claim as they develop. So far, those organizations have published more than 5,000 500, I think, 500 fact-checking articles until now. You can check the all article at Twitter list below. You can see the list below. Yeah, there are a recapitulation with all the article from 30 countries in the world. And how about Tempo? Tempo has published 40 coronavirus fact-checking article in a month since January 2007 until February now, this day. And from the 40 article, we only just claim true claim and 38 false and misleading claim. And these sites become 5 categories of misinformation, such as claim about the cure and prevention methods, conspiration theories, patient condition, how about virus transmission, and about China situation. Okay, next. We found misinformation about the coronavirus on many social media, but the most number was on Facebook. WhatsApp is actually also allowed, but difficult to trace because it's very private. And Tempo is a third-party partner of Facebook to monitor and verify information on their platform. Is a very useful for us to monitor all the viral information on Facebook. Okay, next. These are some examples of misinformation about healing and preventing coronavirus. Maybe in India, claim like this also spreads. Any for maybe about how the cure, I think, how to consuming garlic, drink warm water, marijuana, and Dettol cleaner. Also, I have interviewed with some scientists, and they explain that all the claim is wrong. Okay. Next. This is like so what my question to Owen, because it very went viral in last January ago. The conspiracy theories that the coronavirus is leaking China's biological weapon is also viral until now. One of the triggers is because there are many mainstream media in Indonesia that report it. This information was taken from Washington Times. Do you know Washington Times is one of the media whose content is indeed a lot of propaganda? Their resource was Danny Soham. Danny Soham is an Israeli intelligence expert. I then sent email to Soham to reconfirm again about his statement in the Washington Times. He answered that he don't have any evidence on his statement, and so there really is not any reason to believe in Soham's statement or the Washington Times article. Yeah, and the most misinformation is about condition in probably triggered by the Chinese government, which is not give transparent and good information for public. I think a lot of Chinese videos circulating and sometimes difficult for us in Indonesia because I don't understand China at all and don't use social media that is popular in China like Weibo. But I have been assisted by fact checkers from Taiwan and Hong Kong to understand the local context. So I think collaboration like this is very important to help our work in Indonesia. Okay, next. And assaulting in misinformation is related to a particular religion or ethnicity, like this example you see. Many circulate that the coronavirus in China is a punishment for treating Uyghur Muslim. It's false connecting like that content that can potentially cause xenophobia or hatred toward a certain nation. So it's very important for journalists to provide narrative content like that. Okay, next. Why the coronavirus misinformation is pretty faster in Indonesia? I think because this epidemic causes panic to people, so that people are easily manipulated, including through social media. And a crisis situations like that is an opportunity for someone to make money quickly, and they lack information from health authorities, then can reach all citizens. Also, the important is irrelevant news from mainstream media, such as conspiracy theories or improper healing, like misinformation spreading wider. From me, this is the short tip for journalists, maybe in Indonesia or in India. Presenting and important to provide relevant and science-based reporting. Please contact the expert and use the relevant organization source for you. And please don't report about the conspiracy theories, because it makes the people confused about the coronavirus. And verify all claim against hoaxes. Collaborate with cross-country fact-checks like now, and use many social media for spreading fact-checking articles. Okay, Irene, I think enough for how about tempo to fight the coronavirus misinformation.
Thank you so much, Ika. I think if I could actually ask you the first question, and then we have a couple of other questions as well. My question to you is, how are you collaborating with these other journalists across the borders? Are you on a WhatsApp group? Are you using Slack? Like, what is the way that you actually are working together with other journalists around the world?
Yeah, internal fact-checking network has coordinating our collaborates. We coordinating with the email. We have a Google Doc to list all the misinformation article from us, and then we also have a daily conversation with Slack, and we can discuss about all the misinformation. If I have a difficult about something or a video, I understand what the local context on what's the local language, so I can take for the fact checker in Hong Kong, maybe in Taiwan, or Chinese to help me to can understand what's the meaning of the videos like that.
Great, excellent. Thank you so much. Okay, we have actually, I'm going to hold the rest of the questions until the end, because I know that we promised an hour, but we're already going to go over, I know. So actually, if I could ask, oh, there you're back, yay, okay. If I could introduce Qian, who is with Data Leads and is a health reporter in mainland China. If you could please introduce yourself, and then also go ahead with your presentation, that would be wonderful.
Hi, everybody. My name is Qian Sun, and I am a freelancer journalist, a Chinese journalist based in Berlin, and right now working with Data Leads. And especially we're leading the project of combating misinformation and disinformation concerning the coronavirus outbreak in China. So I think first is Oven and Ika that highlighting that how important it is to actually debunking misinformation. What's the role of cross-border journalism, and also in terms of how important it is for the collaboration between journalists and doctors. I think this is, in terms of a crisis, but especially a global crisis, this kind of breaking the boundaries very important. And I think that's exactly the methodology we've been trying to go over several times. And also, Owen before mentioned that as journalists ourselves, we are the mass communication weapon, and we are actually the gatekeeper and watchdog. But because my role primarily is concerning China, Here I would like to highlight two things that's special about China and actually why misinformation right now is so severe. The problem is so severe in China. And one thing is when we go back to the role of the mass media as a gatekeeper and watchdog, it's supposed to filter the informations and provide the public with trustworthy and trustworthy information. So we are this role, but this role is distorted and the function is partially lost in Chinese media because of the severe censorship. So imagine in a relatively well-functioning media ecological system, you have so many misinformation circling around, and then there are several really credible media outlets, and then these media outlets can actually help with defeating rumors and misinformations. But under a system that is really censored and filtered by the government or by authorities, then the public lost the trust as well to the so-called state media, or the supposed to be media are respected, which furthermore intensified the problem where you can't trust the media from the one spectrum, which is from the civil journalists who are not really well-informed in many ways or have other agendas, and the other spectrum from the supposed to be official information, you also cannot trust them. So this effect in China creates, maybe not only in China, but in other countries where lack of press, free press, it's created this echoing problem. It's the echoing chamber of misinformations. One example will be data, for example. How trustworthy is the data released from different media and official outlets? That's why we also did a story about how reliable the data can be. And this is also an effort for, I think, for constructively reading into the information has been fed from official, so-called official sources. And the other thing I would like to share that's also specific to China is WeChat. I think we all more or less know that WeChat, known as Weixin in China, is the social media of choice in mainland China. It has about more than 1 billion monthly users, and it combines all the basic functions. It's not only just WhatsApp, but also Facebook and PayPal and all the other third-party functions. So let me share the screen of the phone so I can show better how it functions. Here. So yeah, hopefully now everybody can see my screen. And this is the WeChat. So when we look at it, this is the chat function where it's the same as it has this intimacy of a normal social media. So we talked about the problems of the private messaging apps, for example, like WhatsApp. And it's really hard to verify because first it was passed down by peer-to-peer communication and it was forwarded and then replied by a very intimate group. And then people tend to trust this information if it was already sent by somebody that you know, you have a personal connection with. But at the same time, WeChat combines the intimacy of private chat, but as well as powerful social media. For example, this moments here, you can see, here, if I clicked into it, this is the function of a Facebook wall. We can see here, for example, the first one is the Zhong Nanshan, the experts from China, and then he's a very important figure. And so this is the part where all the social media users share their informations. And it's primarily shared by your friends and your relatives. And also a lot of people in China actually relies on this kind of information as their sources, as the news source. So as we can see that the differences or why it's more difficult to tackle the problem of misinformation in WeChat is powerful in terms of combines different functions. and how, even though WeChat does has its own fact-checking efforts, but because it's also under the censorship scheme, as well as there's so much more information that's floating around, it's very hard to verify. And another thing, again, we go back to the cross-border journalism efforts. Sometimes when something happening around you, it's easy to verify, or even sometimes it's related with common sense. For example, that vitamin C can help kill the virus, or alcohol can kill the virus. You can maybe ask a doctor friend, but what if something is happening in India concerning China? It's really hard to verify because not everybody has a friend who is from India, and then you can immediately ask these questions. And also, if something happens that is highly emotional, or something that's really plays into the expectations of people, then they tend to trust. To give one more example that of the misinformation that we debunked here at Data Leads is, so one day there's one post on WeChat started going viral, that there's a big outbreak in India already, so in Kerala. Not only just 3 cases has been already admitted, there are 3,000 people has been quarantined, but medically quarantined. And it caused a really big panic on WeChat and Weibo, the Chinese equivalents of Twitter, because this exactly played into Chinese citizens' fear. They're really worried that another country like India with a huge population would have an outbreak. And if that happens, then the coronavirus is really out of control worldwide. And of course, if somebody says something happens in India, it's harder for even Chinese media to verify. So Global Times, as the leading state-owned media, picked up that story immediately, and then it really went viral. And then what we did is I spotted this post on WeChat. I quickly sent it to my Indian colleague, and I translated it from Mandarin to English. And then my colleague in India can quickly check it and then prove and talk to, of course, local authorities and check with the situation to prove there are certain things which are wrong. For example, the 3,000 people are not medically quarantined. They are actually home quarantined. So then this rumor is quickly defuted. So I think these are the points I would like to contribute to the discussion.
Great, thank you so much, Tian. So I think we have a couple more questions to go. And so I think it'd be great to maybe take a couple minutes. I know we're over time, so if anyone needs to leave, that's absolutely fine. We will not hold it against you. But why don't we just take these last few questions and then we can close the session. So a question from Aji to Ika. The question is, we have seen false reportings of coronavirus incidents from more than 30 cities in Indonesia and no proven case yet. But do you see if there are any signs of a government cover-up?
Yeah, thank you, Aji. I think aside from a question from scientists who doubt the ability of Indonesia to detect coronavirus, I think the Indonesian government doesn't have a good way to provide true information to the public. I don't see any direct public outreach or giving pamphlets to the community like this. I only found it on the Ministry Health website, but do you know, not everyone knows about the website, and not everyone has access to the internet, because Indonesia is a large island, and they're not only in the city, but also living in the rural and who have no good connection in internet. So the Indonesian Ministry of Health should be more proactive and provide information channels that are easily accessed by the public in various ways, so that the public doesn't really in only social media, I think.
Does anyone else have any thoughts regarding this question?
I do actually, yes. And I think, what Chen brought up there was very pertinent, that whenever you have a gap or a deficit in transparency, you have a deficit in trust. And this is something I mentioned about the German health minister the other day. And one of the things he mentioned was we need to be transparent and we need to be open. And anywhere that, what happens if you become aware that someone has lied to you once? You tend to doubt them all the time on any important issue. And this is something that extends to trust in media, to trust in officialdom. And you have the situation in China where, it's not an ideological statement to say that China controls information quite severely. And then just a few days ago, we had this surreal video coming from Iran where the deputy health minister sweated and sniffed his way through a press conference to say that Iran had the COVID-19 virus under control, and less than 24 hours later, it was announced that the poor gentleman actually had the virus. And things like that are not going to inspire great confidence in the public that you're telling them the truth or that you're being open with them. And when you create an environment like that, you're creating an ideal environment for conspiracies and for outlandish claims to spread. So I think official organizations, governments, and so on really need to take a hard look at themselves and say, we're trying, maybe they're doing it with good motivation, maybe they're trying to keep panic down, but you really have to look at how you're doing that.
Yeah,
Thank you, Owen.
I agree with you, Owen.
And actually, Dr. Ankor, I'd love to hear your thoughts on this as a medical doctor focusing on this issue. What happens when when a government is not reporting any cases, and there's questions about issues of transparency and information sharing?
Okay, thank you for the question. I think I would like to answer this question through the vantage point of a medical professional. I'll not go into the details of the transparency is the first thing which should be there from the authorities as well as from the medical community. The reason why we tend to have so many cases, rumors of so many cases, is because especially in this case would be most of the people wouldn't know that it gives the image of a normal flu. The way we deal it in epidemiology, as well as the ministries of health in different places deal with it, you have to divide the cases into suspected cases, probable cases, and then confirmed cases. The confirmation happens through a microbiological test, which is called polymerase chain reaction. So you do a PCR test and you know that the patient is coronavirus positive and needs to be handled accordingly. Now that you have a suspected case, you have to put certain parameters in place because, for example, if they're traveling from an endemic area, they're taking care of or a healthcare professional, for example, taking care of a patient. So you have your suspected case showing signs and symptoms. It could be a normal cough and a normal flu-like symptoms with an epidemiological linkage to a situation or a place or a person who is actually can link them to the virus. Then you do a test on them, and if you don't find them to be positive, then that's your confirmed diagnosis to whether it's a case or not. Now, I don't know the situation so well, the geopolitical one, and the question to Ika was more related to so lots of people at this point, like and Sweeney as well mentioned, there was a man who actually committed suicide thinking that he has coronavirus. So lots of people, and we get it from our family members straight away, and within our friends, even within the medical community, I'm showing symptoms, but then are you having an epidemiological linkage? So you will hear a lot of news, 100 people showing bad flu symptoms will think they have coronavirus while they have the normal flu virus. And that information will bypass straight away into the media or into a public forum, like my colleague from China mentioned as well just now. that's where the danger lies. And that's why we hear so much of unfounded claims that so many cases are there.
Maybe I can just venture in for one more point about if it's an intentional government cover-up or not. Because this is a novel virus, as Dr. has already mentioned, there's many things that even the experts don't know about this virus. That means even the cases, like the tallies, cannot be 100% under control. Because, for example, even the health authorities from China, they have changed the way of what is actually considered as infected cases. And there are different testing methods, right? There are clinical tests, there are laboratory tests, and there's the fast testing kits. And in some areas and countries, they don't have this really fast, they don't have enough testing kits. No? So that's why it also, I think all the uncertainties that we have and the lack of knowledge we have about this virus also contributed to this mass of the numbers and data. So yeah, I would just like to sort of point it out. There are human factors in it, but there I think is also technical factors in it.
Great, thank
Exactly.
you. Oh, Dr. Angkor, please go ahead. Did you have something to add?
I was just agreeing with my colleague from Data Leads that that's so much is unknown about this, but what is known should be put out, and as more information gets available, that should be shared. For now, not limit, but using the scientific process is the best way to go around it. And there are lots of information out there and from credible sources, and we can easily mine into those sources and get the best information.
Great. So we are over time, but that's actually a perfect segue to the last question, which is from Sambit Pal from India. And he asks, where should one go for genuine information when the governments or official sources are not always coming out with proper information, or it's coming from different sources?
Was that for me or for Sunil?
I think this was just a general question for the whole panel. So
from my point of view, there are, I would say people like Dr. Angkor, if they're available, if there are official bodies, because I think that question eventually comes down to where you shouldn't go, because you shouldn't be taking it from random wild sources that turn up on your social media feeds. You can choose to attach as much or as little seriousness as you want to official sources, but the chances are that they're at least going to be more careful about the information they put out there, because they have a reputation to uphold and they have to stand over any statements they make. So I would say definitely look at official sources, look at places like the Center for Disease Control, the World Health Organization, and Dr. Angkor provided a couple of links there, which would be helpful also. But I would say just be careful of not attaching too much importance to random sources of information.
And I think one point that probably needs to be made in this group especially is many of the journalists who are attending this webinar operate in languages that are not covered by the World Health Organization websites or the Centers for Disease Control, which is actually a barrier for many APAC countries and journalists. So I think that the question is how best then to communicate authoritative sources when the source material is not in a language that the user can directly access themselves, right? So, you can link to the World Health Organization when you're doing a fact check, but if the person who is actually consuming your fact check cannot actually read that because it's not in a language that they can read,
I would say,
what's a challenge?
Again, though, I would emphasize this is why we need to have cooperation across borders and languages, because this is where we can facilitate this for each other. Get it available and get it accessible to as many people as possible.
Dr. Angkor, did you have another?
So just what I wanted to add is try to triangulate it. So, for example, if you're getting a local news in a local language, try to reach out. So you have the official sources, but like Sweeney puts out very rightly, they have to be very careful. It has to meet a confirmed case definition before putting it out. And my colleague from Data Leads also mentioned similarly that more information comes in and your case definition keeps changing. One of the ways which I have found in the past as an epi useful is if it's a local news, try to reach out to the local health authorities rather than going all the way up. Go at a very decentralized level. Try to reach out to the PSC, the primary health center, the community health center, or the district health officers and the people in that specific catchment area to find out more information. And the best way is in reaching out to them with local language, local information, trying to triangulate it with your information which you have from the national sources and international sources, and try to give out the best. I mean, your job is very difficult. Fact checking is not easy on a day-to-day life basis, but I mean, this is what I would go out and do as an epidemiologist. Right? Try to use 2-3 sources, reliable sources, and also go to the ground level to get more information.
Maybe one thing I can add up is to maybe also, because this is a novel virus that we're looking at, but there are similar epidemics that happened before, like SARS, like MERS. And for example, in our news story that we're trying to analyze the data, that we talk to different experts who are doing modeling based on the information on SARS and MERS, because essentially it is an epidemic and it follows certain mechanism of transmission. And these transmissions can be modeled by the history of other epidemics. And one of the quotes from this expert is actually really good. And he said, it's epidemic and it follows certain mechanism. It's really hard to lie about it. So I think by looking into the history and by looking not only on specific figures, but more into the background and look at a macro level in terms of looking at the modeling. So then compare the modeling from different experts and then combine with the official sources and data provided by the authority. I think it's a good way to look at it. At least maybe we can't get a very precise number per day, but at least looking at a span of time, we would be able to look at the data constructively and then to know what can possibly the inaccuracy occur.
Thank you so much. Well, we are way over time, 20 minutes over, but thank you all for sticking by. Thank you to our panelists and our speakers. We really value the insights that you provided to this group. And the one last thing I will say is the beauty of this webinar is that it is truly international. And I think that we should take advantage of each other's expertises to really share and to work together. And along those lines, if there's anything that we can do, and I speak now on behalf of all the panelists and on behalf of Owen and Data Leads and Aji, to try to support the work that you're doing to help bring those connections together, please do be in touch with us. We will try to continue to provide these sorts of forums to answer questions and to present on the latest findings about coronavirus and also misinformation in general. So please keep in touch and let us know if there's any way that we can be helpful. So if I can ask all our wonderful speakers to, give a wave, we will hopefully see you all very soon. Thank you so much.
Thank you, Irene.
Take care. Bye.